Hi, welcome back. I'm Dr. Paul Leahy, one of the plastic surgeons here at Monarch Plastic Surgery. This is another video in the series of what to expect at your plastic surgery consultation process and with some of the procedures that we generally perform. This video is going to focus on the mini-facelift. We call it the Monarch Mini-Facelift here in our practice. This procedure was designed around patients seeking improvement, and particularly for tightening of the jowls, which is this area right in here, tightening of some of the facial skin, and just an overall general rejuvenation process, but hopefully limiting the need for extensive general anesthesia procedures done in the hospital with long recoveries. And out of that need that patients were requesting began these procedures that are called mini facelifts. The primary advantage to a mini facelift versus a more traditional or standard facelift would be slightly shorter incisions and certainly avoiding the need for general anesthesia. So we've transformed this into a procedure that can be done very comfortably here in an office-based setting. Typically we'll give you a tablet of something that we would prescribe ahead of time just to take the edge off a little bit, but the rest is done with just numbing medicine or local anesthesia. And it's really, truly amazing how comfortable we can make patients. I have most of my patients say that once they're all done with the procedure, it was certainly no worse than a typical dental visit. So when you come to see us for the consultation process, we'll sit down with you, we'll review your medical history and make sure you're a good candidate for this. Smokers are generally encouraged to quit smoking at least 3 months before and after a procedure like this to avoid complications. And we want to be sure that any medical problems that you might have are well controlled. We can then go through a detailed examination process with you in particular. So I generally like to start from the forehead and kind of work our way down through the neck and have the patient point out to me things that bother them, and I can hopefully provide some solutions and some options, almost like a menu would be, to how we could go about addressing those problems. The mini facelift that we do here in our office is very commonly combined with other procedures at the same time, particularly things like eyelid lifting, or called Blepharoplasty, to help lift the upper eyelids up and rejuvenate them. We like to do skin resurfacing. Sometimes we'll do it at the same time, sometimes we'll postpone that a little bit. I like to use a low-strength chemical peel at the same time. I found that that can really improve some of the fine wrinkles and overall texture of your skin at the same time. The real goal of the mini facelift, I think, is in elevating the jowls, which live right here. These are a compartment of fat that can be then lifted up so that the edge of the mandible or the jawbone has a much cleaner and softer look. And we will also be lifting up the fatty tissues that live here in the middle part of the cheek upward to improve the softness of the lower eyelids and the cheekbones. And then finally, we do remove skin, and that usually is in this direction upward, which can help to tighten up the neck. I would say the biggest limitation of the mini facelift compared to the more traditional much larger facelifts that were done in the past and still are sometimes done would be dealing with skin excess in the central part of the neck, the lower neck here, because you are limited a little bit on what can be pulled up this way with a mini facelift. So if that's something that's really troubling to patients, they may be a better candidate for something done in the operating room. In some cases, we may be wanting to take away some extra fatty tissue in the neck, which can really improve your profile appearance. And that can be done at the same time as a mini facelift using liposuction. Here in our office, we like to use a laser-based liposuction process called Smart Lipo. I have a whole nother video doing that if you want to take a look at that. And then during your consultation process, we can look at some example before and after photographs. Some of those are on our website. We seem to be always under construction with that. In our practice, our overall mantra is very low pressure. We're not going to be calling you to bug you about when you want to do the procedure. Go home, think about it. You can even rewatch videos like this one and make sure it's the right thing for you. And when you're ready, you'll call back to our nurse and we can get you scheduled. We'll bring you back in for another teaching appointment to go over things once again. We'll take some good photographs. We'll give you prescriptions and explain to you what some of the post-operative care is like and what to expect there. We all do things just a little bit differently, so I'll be happy to share with you how I typically do things. And the process takes roughly 3 hours, depending upon if we're combining other things along with the mini facelift. You will leave here with antibiotic ointment covering over the incision lines, and if we've treated your face with a chemical peel, I'll apply that ointment throughout the face as well. We have a very simple dressing. Basically, it's some gauze pads and a little headband that help to collect any drainage that might want to come out through the incision lines, which is very, very common. In fact, almost expected. And so I'll send you home with some things that you can use to help protect your pillow and that sort of thing. Generally want to lay low for the first day or so, but the next day I will have my patients shower very gently. You can use shampoo, and I typically recommend something real gentle on the face, like a baby shampoo, because the pH is normal, and I found that that is very comfortable and an easy way to clean the skin. Then we'll have you apply a moisturizer of some variety, often things like Aquaphor, which can be purchased over the counter, or something similar to that to help provide a good moisturizing base to the areas that are healing. We will often see patients back then the next day in the office just to be sure that everything's healing appropriately and that there are no issues that we can deal with right there. But it is very uncommon for someone to come back after day one for their first visit with any complaints of significant pain. It's a little uncomfortable. Obviously, it's going to feel tight. You will leave here after the procedure looking a little bit funny. And I oftentimes have to warn significant others, about that when you first see it. And part of the process is because it's so swollen. And we'll sometimes see what we call pleats, which are little gatherings of the skin down here in this area. It all smooths out, but we want to prepare you for that, and so you'll not be too worried. But even at day one, I would say 75% of that is gone. It's miraculous almost. So we would see you back, again, making sure everything's okay, but pain is rarely a problem with something like this. Typically, I like to get patients quickly over to more over-the-counter type medications, if anything is needed at all. Then at week one, we'll bring you back. There may be some stitches or sutures to be removed, and we like for you at that point to then meet with our estheticians in our Monarch Skincare Rejuvenation Center to help learn about some of the post-operative products that we'll be having you use to maintain these results. And then typically I'll see patients at about a month or 6 weeks afterwards, at which point most of the time we can take a very nice but sort of an after picture. It happens that quickly. Most people can get back to most activities very soon, particularly if your hair is in a way that covers the incision lines, which tend to run either up in the hairline here or sometimes right in front of the sideburn area. They go right down the crease of the ear. I hide them behind this part of the ear called the tragus, and then they come out underneath your earlobe, and generally they stop somewhere in this region back behind the ear. And so again, if you have hair that covers that, people hardly even know anything happened after a couple of days. It's that good. And if you have short hair, which we certainly treat plenty of patients with short hair, particularly men, obviously, that's something that can be easily managed within a week or so, getting back to work and that kind of thing. I would say the mini facelift is one of my most favorite things to do in terms of in-office procedures. It's extremely safe, it's very comfortable, well tolerated, and more importantly than anything, it's amazing what people will come back and say about how much better they feel about their face and the way their skin looks. It's really a gratifying thing. Another procedure that we sometimes will combine with our mini facelifting is something called fat grafting or fat transfer. So there's really a big focus these days in plastic surgery about this process. Generally what we're doing is we will use liposuction, in other words, vacuuming out of fat from another part of the body. Oftentimes the love handles or the abdomen are easy places to do that from, or the outer thighs is another example. We then, instead of discarding that fat like we would do for cosmetic procedures, we keep it. And we, the same procedure, we will prepare it in a way and then we can actually re-inject it into areas that we want to add volume. So one of the problems is that as we age, we lose fatty tissue support in our face. And so by adding that fat back into the areas that you want to fill out, it's amazing how much more youthful that the skin and the face overall can look. So that's a basic overview of the Monarch Mini-Facelift and some of the other procedures that we will oftentimes combine with that. And we just tailor this experience to you. We'll be very intently listening to what you tell us are things that bother you and trouble you. And hopefully you can put together a plan that will suit your needs. And I hope that you found this video useful, and you can certainly refer back to it. Thanks for watching.